How does a specialist treat pulmonary hypertension, and what should a patient expect?
So the treatment of pulmonary hypertension really depends on what causes it. Now we can say you drive a car, but that's not the same as saying you drive a Toyota or a Ford or a Honda or a Rolls-Royce. And everyone is different, just like every type of pulmonary hypertension is different. It's up to us as lung specialists to make sure that patients are being treated for the correct type that they have and in the best way possible. There are certain causes of pulmonary hypertension that respond very well to certain medications. There are other causes of pulmonary hypertension where those same medications actually cause harm. They can cause patients to have more complications and to actually have a higher risk of death. And it's our job as lung specialists to really say, what is it that you have that causes this problem and what's the best way to treat it? For some people, it's treating chronic blood clots in the lungs, and we put you on blood thinners. We make sure your oxygen doesn't drop low. For other people, it's because the heart itself is backing up all this pressure into the lungs, and we really focus on the heart. And for some people, it is the blood vessels themselves that become too thick and too muscular. And being strong is not always a good thing, because if they're squeezing too hard and raising this pressure and causing you disability from shortness of breath and inability to do the things that you want to do, we focus on those blood vessels. And we have medications that can be taken as a pill, some are inhaled, some are shots, and some go through a vein and do things like tell those blood vessels don't build up so much muscle, or relax a little bit and let this pressure come down. But again, we have to be very specific as to what we use, because we never want to cause a patient harm. I tell every patient I ever see, don't let a doctor just tell you to take something just because. Everything has side effects, and you should understand what it is that somebody's treating you with and why they're using it, because we never want to give patient risk without benefit.
To schedule your appointment with Dr. Schreiber, call 702-671-5060.